Chronic granulomatous disease is one of those conditions in which the ability of white blood cells to kill invaders, mostly bacteria and fungi, is impaired. And it's impaired because normally cells are supposed to make bleach in order to kill things. Now, the way bleach works here is a little complicated. It's more like a signal than like an actual killing agent. But that signal gets disrupted, and when that signal doesn't get sent right, the cells don't kill bacteria and fungi properly. And so what happens is that patients with CGD develop bad infections, and those bad infections can be serious and fatal. In addition, though, what makes these immune deficiencies so complicated is that not only do they get bad infections, they can also get bad inflammatory problems. And by that I mean things like inflammatory bowel disease, inflammatory lung disease, some skin conditions, all of which really are sometimes referred to as autoimmune or autoinflammatory type problems. CGD is an inborn problem, so people have it from the moment they're born. And yet it takes some time for it to show up. Usually, in the more severe forms, it shows up before 1 year of life in boys. And it can show up as an infection, can show up as inflammatory bowel disease or severe diarrhea, sometimes shows up as problems with swallowing or with eating. And then some of the later manifestations can be infections, diarrhea, failure to grow normally. Usually, most cases are diagnosed in childhood before about age 5. However, there are people who have milder forms who show up later in life, and people can be diagnosed in adolescence, in adulthood, sometimes even in late adulthood. And the oldest known patient who was diagnosed with CGD is 69.
CGD is a defect of neutrophil function and not number. So patients with CGD may have completely normal neutrophil counts, and often they do. You would not typically see neutropenia in patients with CGD. However, the neutrophils don't function normally. And in the most severe forms of the disease, the bacteria can be engulfed by the neutrophil, but the neutrophil cannot kill the bacteria. So what this leads to is large granulomas, hence the name, as well as pus pockets or abscesses, which can be found in any organ, most notably the liver, the lung, the skin. And this leads to bacteria that are walled off but not killed, and ultimately those bacteria then find their way either into other organs or into the bloodstream, where they cause severe illness.
Early diagnosis of CGD is very important because there are fantastic drugs we have now that we didn't used to have that can help prevent a lot of these infections and decrease morbidity and mortality in these patients. And so now with great antifungals, which have really changed the way CGD is managed. Patients are living longer, they're staying healthier. And also with early diagnosis, definitive curative treatments such as bone marrow transplant is actually an option for some of these patients depending on the circumstance. And earlier transplant in CGD has far better outcomes than later transplant because you're catching them early before they have liver abscesses or other fungal infections that could make transplant later complicated when they're immunosuppressed for the transplant. So we have a patient right now at our hospital who is diagnosed based on family history right at birth, and he has been managed on fantastic medications, including interferon therapy, as well as antifungals and sulfa antibiotics, and he has been completely infection-free for over a year. I think that the early diagnosis really made a big difference.